Guys, it's Kent here, the Docpods Podiatrist, just discussing another one of our videos. And what you can see me doing here is we're debriding a neuropathic diabetic ulcer. So this sort of ulcer comes around in an uncontrolled diabetic when they let their blood sugars go very, very high or very, very low. And this damages and starts to damage the nerves in the feet, hands and eyes. And it also damages the little blood vessels in these locations as well. So what ends up happening is the diabetic ends up with a foot that doesn't feel very well, so the nerves are compromised, and then it doesn't heal very well. So this leads to the situation where they'll walk around and they'll walk and get sort of some hard callus or some corns on the tips of their toes, as this patient did. And then the tissue underneath that starts to break down because they don't know to move their foot or look at their toes because it starts to hurt. And eventually what happens, the tissue underneath breaks down and then it forms an ulcer. So how we treat this is we debride all the dead callus and the non-viable tissue right down to the base of where the living skin is, and you can see then what we do is we try and remove the undermined edges of the ulcer, as these won't heal. So that's what we're doing right now with the scalpel, just removing the undermined edges and debriding all the non-viable tissue down to the living skin. And often we all get a little bit of blood at the point where we're right down at the living skin, so that's actually quite normal to see a little bit of blood with these. So the best thing you can do for a diabetic neuropathic ulcer is try to prevent it. So that's watch your blood sugar levels, watch your diet, and do some regular exercise. Thanks.